Good evening, everyone. My name is Sarah Felman. I am an FNP student at the University of St. Augustine for Health Sciences. This evening, I will be presenting my synthesis project. So I've decided to examine sleep hygiene as an evidence-based practice to decrease rates of ICU delirium. So that's what I'll be discussing today. So first, I'd like to provide a description and the significance of the practice problem. So ICU delirium is defined as an acute state of consciousness that fluctuates as well as altered mental status. This can be characterized by some hallmark symptoms such as agitation, restlessness, removal of their lines or cardiac monitoring devices, which can be very dangerous and even life-threatening, confusion and disorientation, hallucinations, which may be visual, tactile, or auditory, impaired memory, as well as dysregulated mood and sleep patterns. So, scientists believe that this is actually the result of sleep deprivation due to environmental stimuli in an ICU setting. So, if you've ever been to an intensive care unit, it's very loud. There's a lot of alarms, bright lights. Nurses are performing interventions at all hours of the night, which makes it very challenging for patients to sleep. So due to this lack of sleep, studies show that patients are developing higher rates of ICU delirium incidents. However, this is not the only cause. It could also be due to critical illness as well as infection, sedating medications, which can alter their mental status, as well as mechanical ventilation if the patient needs some sort of ventilatory support. This has also been shown to cause ICU delirium. This issue is a significant problem because those diagnosed with ICU delirium demonstrate not only increased admission stays and increased associated costs with those admission stays, but also higher rates of mortality. So this is a very serious problem that definitely needs to be addressed. So in order to address it, I have decided to develop a problem statement. So I'll be analyzing the population of patients aged 65 to 95 years old who are admitted to an intensive care unit and have tested positive for ICU delirium. So that's going to be the population. Second, the intervention is going to be sleep hygiene protocols, and I'll be describing those a bit further in a moment as well, compared to standardized nursing practices. The overall outcome we hope to achieve is to decrease the rates of ICU delirium, and we're going to analyze this over the time period of 72 hours after their admission, as this is typically when patients will develop these rates of ICU delirium. So in order to enhance this problem statement, I have performed a synthesis of the literature. So the purpose was to find resources that directly related to this problem statement and not only find them, but also evaluate the relevant data for credibility. We want to make sure that we're using reputable sources here. So in order to do that, I've used key terms such as ICU delirium, confusion, sleep hygiene practices, and ICU psychosis. And I've also analyzed these terms, applying them to specific databases such as the National Library of Medicine, Medline Ultimate, as well as Google Scholar, just for some examples. And I wanted to go ahead and apply some search filters to this criteria to meet inclusion and exclusion within these databases. So I only wanted to include scholarly peer-reviewed articles with credible sources and data collection methodology. Second, as I want to make sure that I'm using the most relevant data, so only data that's been published within the past 5 years. And then the third is only sources that directly relate to this problem statement. So as a result of these search strategy, I have received a plethora of very reputable resources and literature that has provided me with some additional insights and information that relate directly to this problem statement that I've established. So I also want to analyze and provide a synthesis of the literature to support a proposed change to actually decrease these rates of ICU delirium. So after analyzing all of this literature that I received, this scholarly research reflects a few common themes amongst the data. So the first is a lot of researchers commonly agree that sleep is highly disrupted in the ICU, and that can be due to a variety of environmental factors. Not only does this contribute to increased rates of ICU delirium, but it also has been shown to increase rates of post-traumatic stress disorder, as well as prolong the hospital admission stay for these patients. The second common theme is that sleep hygiene is an effective nurse-driven intervention that can actually decrease these rates of ICU delirium. So what I mean by sleep hygiene practices, oftentimes nurses will provide earplugs and eye masks to help assist the patient in achieving a good night's rest. Because this can kind of help mitigate some of those loud sounds, those bright lights, as well as regulating the sleep and wake cycles. So during the day, opening the blinds, ensuring that there's proper light, stimulating the patient to stay awake during the day, and then really putting in a lot of effort to ensure that that patient gets a good night's rest overnight. So some of the things that nurses can do at night is to decrease environmental stimuli as well as cluster their nursing care. So only waking the patient when necessary and really trying to decrease stimuli so that person can get a good night's rest, as this is shown to be an evidence-based practice that will decrease rates of ICU delirium. So next I want to describe the setting for which I'm going to plan the change and plan to actually implement this outcome. So the intensive care unit is, or the ICU, this is a unit of the hospital where the population is most commonly admitted for critical care interventions. So these are very high acuity patients, very sick patients, and they need to be admitted for advanced monitoring and life support for a critical illness, or it could be a critical injury. And of course, these nurses are going to be highly skilled and trained to be able to monitor these patients in these settings. So because these patients are higher acuity and requiring further interventions and monitoring than your standard med-surg floor, oftentimes the nurse to patient ratios may be 1 to 1, 1 to 2, or occasionally 1 to 3. So we're going to see a higher rate of nurses compared to patients. As well to provide this intensive care unit care for these folks. Next, I would like to address my proposed change process, as well as the change model that I'll be applying to complete this task. So the proposed change process is to implement sleep hygiene practices, such as sleep masks and earplugs within this ICU setting that I just described. So first and foremost, we're going to develop a team of stakeholders and evaluate financial resources for purchasing these materials. So obviously purchasing earplugs and eye masks may cost some additional monetary sources for these hospitals. Next, we're going to train staff in sleep hygiene practices and make sure that they understand how to implement such interventions. So nurse staff as well as support tech staff. And then we're going to monitor the progress utilizing an evaluation plan. So the model that is most appropriate to implement this change is the Lewin's change model. So the first step is to unfreeze. And what I mean by this is we're going to actually start preparing for a change. So how we're going to do this is we're going to identify a problem, gather stakeholders, and prepare to implement interventions. The second step is the actual change. So implementing the interventions of applying sleep hygiene practices to the ICU setting. The third, if this evaluation has been successful, then we're going to refreeze. So what I mean by that is we're going to stabilize the successful changes as an evidence-based practice and policy in the hospital. Next, I want to go over how this data will be collected as well as analyzed. So the intervention will be sleep hygiene practices compared to the control group, which will be your standardized nursing care that does not prioritize these practices. The outcome is the hope that patients who receive sleep hygiene practices will exhibit decreased rates of ICU delirium compared to their counterparts who receive standardized nursing care. We're going to analyze this change within 72 hours of their admission to the ICU. And this data analysis is going to be performed using the CAM ICU assessment. So as you can see on the right, this is a very short, easy to perform questionnaire that nurses can actually perform pretty quickly. And they can perform it once or twice a shift as necessary or in any change of patient status. And it's going to assess if the patient is positive or negative for ICU delirium. If you use the program Epic for electronic charting, this will populate automatically for the nurses. So it's a really great way to assess if a patient has been tested positive or negative for ICU delirium. So it'll be an easy way to collect and analyze that data to see if it's actually effectively decreased rates of ICU delirium by providing sleep hygiene practices. So next I want to understand the evaluation plan as well as the criteria with measures. So we're going to analyze the effectiveness of sleep hygiene to decrease ICU delirium. So the criteria for doing so will be a reduction in ICU delirium incidence, and the measures are going to again be the CAM ICU scale, which you can see on the right. So we want to understand if patients are testing more positive or more negative on this scale, evaluating the intervention group versus the control group. So we want to perform quantitative data analysis based on this material, understanding that those who receive sleep hygiene practices, do they or do they not exhibit lower rates of ICU delirium compared to their control group? So this is truly what we're understanding and evaluating here in this study. Next, once we've performed the study, we've gathered our data, we've understood that it's an evidence-based practice. We want to go ahead and disseminate these results so that other organizations, institutions, and facilities may be also able to utilize these policies. So I have a few presentations that I would like to perform. The first is here locally at my own hospital, UF Health Shands in Gainesville, Florida. They have a 2027 Nursing Research Summit lectureship. So I believe that this data would be appropriate to present at that opportunity. Next, regionally, looking at the entire state of Florida, we have the Florida Chapter Society of Critical Care Medicine Conference. Again, this data would be appropriate to share at that conference. And then looking at a national scale, we have the Society of Critical Care Medicine, which hosts an annual Congress event, as well as the American Association of Critical Care Nurses, which also hosts a national exposition. So there are local, regional, as well as national opportunities to present this data. Second off, we want to understand that, obviously it's also necessary to publish this data. Not everyone's going to be able to attend these conferences, but we still want to spread the word and get this evidence-based practice out into the community, out into the world. So this is done through publications. So a few appropriate journals that we have the American Journal of Critical Care, the Journal of Healthcare Quality, as well as the Journal of Clinical Sleep Medication. So all of these publications would be appropriate to publish this data. So in conclusion, ICU delirium is a prevalent healthcare issue that contributes to higher rates of patient mortality, economic costs on healthcare systems, as well as increased hospital stays for patients themselves. However, in order to combat ICU delirium, sleep hygiene interventions are established as an evidence-based practice for decreasing ICU delirium. This has been established through performing a search strategy as well as synthesis of the literature. So we want to go ahead and implement the intervention of sleep hygiene practices, and we will analyze this data utilizing the CAM ICU assessment questionnaire, which is very easy for nursing staff to perform. After we've established that this is an evidence-based practice, concluding the analyzation of the data, we want to disseminate these findings on a local, regional, as well as national scale through presentations and publications as well. Evidence-based practices enhance the nursing profession. They also enhance the lives of patients, improving quality care outcomes and overall patient safety as well. I will take questions from the audience at this time. Here are the references that I've compiled and utilized to conduct my presentation. Thank you all so much for attending my presentation. I appreciate your time.